So I will start. It is just 4:30. And my name is Malin Björk. I'm a member of the European Parliament from Sweden, the Left Group. And I have Fred Matic here from Croatia, member of European Parliament from the Socialist and Democrat Group. We also have our guests here, which I will introduce in just a little bit. But just to invite you to this press conference, it's about the access to sexual and reproductive health and rights for Ukrainian refugees. As you all know, we just seen a prolongation of the Temporary Protection Directive, luckily so, but we see from our side that there is a great lack of attention to the access for sexual and reproductive health and rights care and services when it comes to all these Ukrainian women that have fled the bombs shelled by Putin. So it is timely to have this meeting today and this press conference, and we will also tune in for a debate in the plenary that we will have later tonight at 8 o'clock, which I invite you to. But this is our way of putting this on the agenda and making sure that we don't fail. We have promised to support Ukrainian refugees, women refugees coming to the European Union, and that cannot be a half-hearted business. It has to be wholehearted, and being wholehearted in the support to women refugees means that you also provide for all the panoply of reproductive health care that is needed. So with those words, I want to give the floor to my colleague, Fred, from the Socialist and Democrat groups, but also the rapporteur of a very important report from this House on sexual and reproductive health and rights. Please, Fred.
Hvala lijepa, Malin. Hvala i svim predstavnicima medija na dolasku. Hvala i kolegicama iz nevladinog sektora koje su danas ovdje. Što reći? Kada zakaže država, onda uskače nevladin sektor i na tome smo im jako zahvalni. Kao bivši ratni veteran i prognanik znam dobro što je rat. I zato kada slušam priče koje doživljavaju ukrajinske žene i djevojke, ne mogu da se ne zabrinem i da si postavim pitanje zašto i kako dalje. Naime, hvala zemljama koje su prihvatile izbjeglice, koji su im pružile gostoprimstvo, međutim u 21. stoljeću, gotovo polovini 21. stoljeća to nije dovoljno. Dati prognanicima, izbjeglicama kruha i vode, to više nije dovoljno. Žene koje dolaze iz Ukrajine bile su izložene velikom i teškom teroru i sada kada su stigle u Europsku uniju, misle i s pravom očekuju da prema njima bude postupano onako kako se postupa i sa građanima i građankama cijele Europske unije. Izloženost ratnim razaranjima, izloženost silovanjima, izloženost svim ratnim zločinima koje ruska vojska sada čini na području Ukrajine za žene i djevojke koje dolaze u Europsku uniju misle da im je to spas. Nažalost, one su ponovo viktimizirane i to je ono nešto najgore što se može dogoditi izbjeglicama. Tražimo da njihov pristup temeljnim ljudskim pravima, a to je zdravstvena skrb, pravo na pobačaj, pravo na kontracepciju, zaštitu od silovanja, ostvaruju jednako tako kako i ostvaruju oni naše sugrađanke i sugrađani u cijeloj Europskoj uniji. Svaki puta kada postavimo to pitanje i kada kritiziramo zemlje članice, one se uvijek pozivaju na ono čuveno kompetencije država članica. Nećemo to više trpiti. Dakle, vlade zemalja članica, komisija i vijeće morate učiniti sve da pružite zaštitu ukrajinskim ženama i djevojkama, jer one sada odlaze u svoje razrušene domove, polurazrušene bolnice da bi ostvarile temeljna ljudska prava koja ne mogu ostvariti u zemljama Europske unije u kojima su došle kao izbjeglice. To moramo spriječiti ili ćemo se stvarno zapitati i vijeće i komisiju i države članice što to činite i kakav je to život i kakvu sigurnost jamčimo najtežim žrtvama rata. Hvala.
Thank you, Fred. And now I will give the floor to three of the civil society organizations that have contributed to the very important report Care in Crisis, which I will show to you later. It's a report that has documented the lack of access for women to basic sexual and reproductive health and rights, but also documented the way that civil society has stepped in where the state institutions are failing women. So first I will give the floor to Erika Schmidt, the Executive Director of the EMA Association in Hungary. Please.
Thank you very much. Over the past year, together with 8 other organizations, we conducted fact-finding into the situation of refugees from Ukraine who need access to sexual and reproductive health care and gender-based violence support in Hungary, Poland, Romania, and Slovakia. The findings of our work are outlined in the report named Care in Crisis, which is available here in the room as well and online as well. It's downloadable. Our findings show that very serious barriers are combining to make access to these forms of care and support very difficult for women from Ukraine in those 4 EU country member states. What are these barriers? High costs and financial barriers, lack of information and language barriers, lack of basic good quality services, legal restrictions, and discrimination. What is the impact of these barriers? We have found that many women are traveling back to Ukraine, a country at war, to access basic sexual and reproductive health care. Other women who cannot make this journey simply delay care as long as possible, and we all know that delaying care means risks, increased risks in their health. Others access care outside of legal pathways. Others are able to access care only because they are lucky enough to be in contact with the NGOs that help them on the field with direct support. This is a completely unacceptable situation, and there are concrete actions that the EU institutions can take to address some of these barriers at least. There is clear EU competence to address a range of these barriers. The Temporary Protection Directive clearly sets out member state obligations to provide emergency care and essential care to all refugees who need it. It also clearly sets out an obligation to provide all necessary medical care to survivors of sexual violence. We now need urgent action from the EU institutions to ensure effective implementation of these obligations at all the member state levels. Thank you very much.
Thank you very much, Erika Schmidt from the EMA Association in Hungary. I will now give the floor to Irina Matescu, co-founder of the Independent Midwives Association in Romania. Please.
Thank you. The reality is that despite the obligations in the Temporary Protection Directive, many women from Ukraine cannot access affordable and safe sexual and reproductive healthcare services in our countries. For example, in my country, Romania, my organization has provided assistance to tens of thousands of women from Ukraine to seek reproductive health care, antenatal care, postnatal care, abortion care, family planning, and free contraception, reproductive health checkups and treatment also. In almost all cases, we have had to pay for the care for them through private healthcare providers because it is extremely difficult to secure this care in the public healthcare system. Abortions are not offered in public care at all, and medical abortions are not offered in most cases because of the lack of training and willingness from the medical professionals and decisional factors in Romania. Also, language barriers and information barriers are quite an extreme barrier for these women. This is still not enough. There is still not enough public information available for them in English or Ukrainian about their rights and how to access sexual and reproductive health services in Romania. Also, there is a lack of translators for the medical consultations in the hospitals and primary healthcare facilities. Obstetric violence during childbirth, it's a serious problem in Romania and Hungary the same. And for women from Ukraine who are giving birth in our countries, this is a hugely traumatic problem as they are not used to this kind of practices, as they are not normal in Ukraine and shouldn't be normal anywhere else. we have seen many cases of refugees in Romania who actually decide to go back to Ukraine temporarily to give birth because they do not want to give birth in a Romanian facility, being afraid about the kind of treatment they will face. For example, partners are not allowed to be with women during childbirth. Newborn babies are taken away from their mothers after birth in 100% of the cases, sometimes for more than 1 day. There are issues that have existed for years, have worsened in the recent years, and have had an even more severe impact on refugee women. Romania urgently needs to improve medical services for sexual and reproductive health for pregnant women and newborns, because Romania has some of the highest rates for maternal and infant mortality in Europe. We need action on several levels to address these serious concerns by member states, by the Commission, by the Council, and by the humanitarian community. Thank you.
Thank you very much, Irina Matescu from the Independent Midwife Association, Romania. Now I will go to my other side here. Kristina Kachpura, you're from the Foundation for Women and Family Planning, a long-standing champion for SRHR in Poland. Please.
Thank you very much. First of all, I would like to pay your attention for the report, because this is the first report on lagged access for SRHR services in this region after the Ukrainian war, during, not after. So we had no time to write reports, but thanks to the great engagement of Center for Reproductive Rights, we did our best to prepare our part with your management, and so thank you for this, because we could publish this report in Polish and send to our authorities as well. We promote also on European level within the Parliament and Commission. As it concerns our help for Ukrainian refugees, women and girls, since the invasion of Ukraine, I have personally helped many women from Ukraine who were raped with access to urgent reproductive health services. From the very beginning, we as a FEDERA, Foundation for Women and Family Planning, we are the only one organization working on SRHR issues in Poland, the registered one. So we were sure that we had to help Ukrainian refugees in access to basic reproductive health services. Although these women should have access to all medical care, they need, following rape, HIV prophylaxis, STI test, emergency contraception, abortion care if they are pregnant. So the reality is that they often do not receive this in Poland. This is still happening, even though we were more than 18 months after the invasion. The Temporary Protection Directive clearly says that member states must provide survivors of rape and sexual violence with all necessary medical care and other medical services. But in Poland, we still do not have clinical guidelines in place for the clinical management of rape. We still do not have guidance for service providers on what care must be provided to survivors of rape and what care the state must pay for. Even though abortion is legal in situations of rape in Poland, in reality, it is not accessible in practice, because women have to report the rape and get a certificate from a prosecutor. For many of the women from Ukraine that I spoke to who need an abortion after rape, they simply do not want to follow this complicated procedure. They simply want to end the unwanted pregnancy resulted from rape and move on with their lives and care for their families. So I really hope that together we can start to change this difficult situation. Thank you.
Thank you very much, Krystyna Keczpura from Federa, the Women and Family Planning Association in Poland. And I will just finish these presentations by saying a very big thank you to all three of you for stepping in and providing the care when state institutions and the EU is failing, and to actually see women and what their needs are. And I know you do this for Ukrainian refugees as you do it for the Hungarian, Polish and Romanian women. So I just think that that needs to be said as well. And for those who have not seen the report, yes, it's called Care in Crisis, where we have your documented contributions, but also some recommendation. It has been coordinated by the Center for Reproductive Rights, which are also here with us. So with those words, I want to know if there are questions from journalists online or in the room. You can, on the screen, you can just push your little hand there. I don't see any hands coming up. All right. Then I will just pick up on some of the things that you've said. You said that the Temporary Protection Directive does give not only the possibility, but also the obligation to make sure that we respond to women's real needs. And you also said that the situation sometimes domestically is very bad. And we know the situation in Poland, but we also hear about Romania and in Hungary. And if it's bad for women, domestic women, it is even worse for women refugees, of course. So in that sense, I think that our mission is also to move forward in highlighting the need to reinforce these services across the board. Do you want to speak anything about that as we have this moment? Maybe I will start by Hungary again, if that's fine.
Specifically, what you mean?
What actions do you need to see in Hungary in order to make sure that the sexual and reproductive health services provided respond, of course, to the need of Ukrainian refugee women, but also to Hungarian women's needs?
Yeah, that's a very difficult question because the Hungarian healthcare system is facing very serious structural problems. And I think the key for the solution is really in the hand of the government. So especially regarding maternity care or access to high-level maternity care, it's not only needed to reform the education of the health professionals, but also to reform the funding system of the maternity care system in Hungary. It should also be reformed in a very systematic way to make access for women living in the rural area much easier to high-level specialized care in Hungary. So I would highlight here that all those structural barriers that we faced cannot be tackled, by correcting very specific challenges, but rather having a more complex, holistic way to the systemic change itself within the healthcare system.
So for our country to get very concrete, I think we need to have free antenatal care for real, because 2.6% of Romanian women have had access to free antenatal care in 2021. So if you are privileged, you can access services, but if not, you are left outside. Also free midwifery services, because we can work in private, but midwives cannot offer public services at their full scope of practice in Romania. And postnatal care could be improved with the implementation of the baby-friendly program, because it was dropped out of the care in hospitals. And good training for obstetricians to promote natural birth and to improve the impressions on women, so to drop down the obstetrical violence that we are facing in our countries, and integrating midwifery in the team, midwives, all over the level of care.
Thank you. And in Poland, which hosts enormous, millions of refugees, but also has this very, very challenging situation domestically for women, not where abortion care is banned, where sexual and reproductive health and rights is taboo, where women are left, stranded.
Yes, 75% of Polish women voted for regaining their reproductive rights in the last election. So we promised these women to change the law. So the first extremely important issue for us will be the new law on abortion. It's of course not easy because of a president, because of other parties, but first of all, we will push the ruling parties to decriminalize abortion, because it enables women to get access in difficult situations, And then, of course, step by step, sexuality education, because our youth and adolescents are deprived of basic knowledge on sexuality, contraception, family planning centers. Poland takes the last place in Europe as it concerns to access to contraception, and emergency contraception with no prescription selling on the counter. So shortly, the most important for us right now is decriminalization abortion, because our gynecologists usually say that we can't do because we will be criminalized. We don't want to go to the prison because of your abortion. So this is the most urgent issue for us in Poland. Thank you.
Thank you. Does anyone that have joined us have any questions? I've looked at the screen here down, all the people online. If there are no questions, I will give the floor back to you, Fred, and then I will make some closing remarks. So please, the floor is yours.
Hvala, Malin. Pa evo sad kad su sve zemlje rekle kakva je situacija u njihovim zemljama i kako je to vrlo teško, ja ću vam reći kako je u mojoj zemlji Hrvatskoj, u kojoj je pristup seksualnom i reproduktivnom zdravlju dopušten zakonima koji su doneseni prije 45 godina. Međutim, u posljednjih nekoliko godina, zahvaljujući, pod navodnicima, ultrakatoličkim organizacijama, učinilo se sve da se taj pristup seksualnom reproduktivnom zdravlju oteža, što znači da postoji nekakva savjetovanja, uglavnom postoji čuveni priziv savjesti u kojoj u većini bolnica u Hrvatskoj pobačaj je dopušten, ali jednostavno nema ga ko učiniti. Naravno, tu je uvijek prisutno i licemjerje gdje je dobra većina tih liječnika u javnoj bolnici kažu da zbog priziva savjesti ne rade abortus, ali onda vam gurne vizit kartu u ruku i kaže da dođete poslijepodne kod njega u privatnu ambulantu, tad će to biti označeno kao spontani pobačaj, ali pobačaj će biti izvršen. Dakle, niti u zemljama u kojima je sve to zakonski dopušteno nije sjajno. Onda mogu tek misliti kako je to u zemljama poput Poljske, Mađarske, Rumunjske, Slovačke. Hvala.
Thank you. If there are no further questions, I would like to once again invite you to read the report, Care in Crisis, coordinated, where our guests have contributed, and where you can read more about the situation on the ground. Once again, I want to thank you for stepping in where the state and the EU is failing women. It is very cruel and it's brutal, but you are there. And the fact that you have provided for tens of thousands of Ukrainian women this support that they are entitled to. that situation, it has to change. And that is why we're having a debate tonight at 8 o'clock. Around 8 o'clock, we'll have to look at the plenary agenda, which is a moving target, as many of you know. But do tune in and listen to us. It is time for the European Commission to step in. They not only can do more, they must do more now. They have the tools set out in the Temporary Protection Directive, and they have to start to use them. They also have financial tools. Civil society organizations should not be left alone like this. And as you have heard, it's a range of services needed. It is everything from prenatal to postnatal care, pregnancy care, giving birth, having the right to contraception, emergency contraception, and it's also about abortion care, of course, and treatment when it comes to sexual violence victims. So all these fields, we need to step in and step up as the EU. And we will be a great number of members of the European Parliament highlighting this in the debate to come. We are counting on the Commission from the top. Ursula von der Leyen, she is ultimately also responsible. Ylva Johansson and Commissioner Dalli, of course. But this goes way beyond the Commissioner for Equality. With that, I want to thank you, and I invite you to, of course, contact our guests individually if you want more information and to read the report more in detail. So thank you, everyone.